Hello, my name is Bhagyashree Shetty. I am a consultant pediatric dentist from Pune, India, and I have been practicing for the past 3 years. I know exactly what you will be feeling right now because I have been in the same shoes. But I didn't clear my first ADC attempt. In the September sitting, I failed terribly with grades A, B, C, and D. And to be honest, I hadn't prepared enough. I was juggling with multiple clinics, traveling 50 kilometers a day, working, and I had to manage my finances, and I could barely take 15 days break before exam. And I honestly feel that was not enough. And when I saw the exam paper, I had panicked. I couldn't even understand the questions properly. I froze. The memory still shakes me. But I knew one thing, I wanted to try again. So I reached one of my friend for advice who had cleared ADC, and she simply said, take Dr. Raza's course and just trust it. And I'm so glad I listened. Once I joined, everything changed. The portal was so structured. I exactly knew how to study and how to go step by step. I didn't get time to read 100% of the material, but I covered 70 to 80%. I revised PG, infection controls, and more importantly, I immersed myself in the mock exams. I took all the mocks very seriously. There were more than 20 mocks. Also, there were group mocks, grand mocks, and multi-subject mocks. These mocks helped me understand not just the correct answers, but why the other options were wrong. And that changed how I looked at the questions entirely, which I failed to do last time. For that, as Dr. Raza says, you have to go back to the mocks and revise the mocks. And the more you revise, the more you can differentiate between different questions of the same type. And I wasn't doing this alone. I had a study partner, and every day we would study from 9 a.m. to 1:30, 2 p.m. This is what I did from December to March. And throughout that routine, because since I was studying with a study partner, I was accountable and I had a support. And then I also got married this February 3rd. But I only took 4 to 5 days break for the wedding, and the rest time I was just studying. Even when I was going out for shopping, I would come home, switch off the world, and I just used to get back to ADC, because no matter what was happening around me, ADC had to be my priority. This time I gave myself like 1.5 month break from work. And yes, I lost few clinics. In fact, just 2 days before the results came, I found that I have been replaced at few clinics. I was shattered. I was broken. Also doubted myself if giving ADC was a mistake, and what if I fail and I've lost so much already. For the whole day, I doubted myself, my decision, my path, everything. And then 2 days later, just results came and I had passed. That moment taught me something I'll never forget. Taking a break was necessary, because I can't sail in two boats at the same time, and I had to choose what mattered the most. And for me, that was this ADC exam. Now, also the mock exams were next level. Dr. Raza covers basics to advance. So by then, since we are so used to tough questions, that by the end of when you're nearing your preparations, you start making mistake in silly ones. So his mocks covers almost everything, and this had happened to me. I also became more emotionally stable this time. I'm not naturally a calm person at all, but solving 20 mocks made me mentally stronger, because during this exam I was calm, composed, and focused. And that was a huge shift from my previous attempt, because I had experienced all fear when I was giving because I had experienced all this fear when I was giving the mocks, the routine mocks. Also, I made a few silly mistakes even this exam, but I passed. I guess everyone does it. And and also there were days when I used to feel like quitting. I don't want to do it. I was frustrated. But I guess in those moments, all we have to do is zoom out and look at the bigger picture. And if you are with Dr. Razak's course, you are not alone. He answers even the lamest questions with patience, and the study group is incredibly supportive. The mock exams and the mock discussions are really like a cherry on the cake. You can ask all possible questions and get the doubts cleared. Dr. Raza is very, very, very patient with the questions, irrespective to how long the sessions are going on. So if you follow the plan and trust the process like I did, you will pass. If I could, with the full-time work, travel, self-doubt, financial pressure, and wedding, you guys can do. So stay strong, stay focused, and keep going. You all have got this. Thank you.
Yeah, sure, doctor. Hello everyone, I'm Mitra Sadanandan. I'm living in Australia right now. So my ADC journey started like a year back. I have a little kid
Sorry to
and
interrupt you,
family
Doctor. Yeah,
here.
sorry to interrupt you. But candidates who would like to ask questions later on, they can drop their question in the chat section. Either me or these candidates will answer. All right. Yes, please continue.
Yeah, sure, doctor. So when I started 8 months back, I decided to go with Dr. Raza because there are so many positive inputs saying that part one course is very highly structured and it's very organized and he is very good teacher. So I just went with that because I know no one I just trusted all the reviews and stuff. When I started 8 months back, he always from the start till the end, he just keep motivating each and every one. Because we also have a separate WhatsApp group in which is very useful as well for discussing questions and also for bit of motivation and bit of push as well. So try to follow that group. And if you have any questions, just put a message through and someone will be just giving the input, or else most of the time Dr. Raza will be answering the questions as well. For the first 5 months, I took it bit slow. I just took my time to go through all the core subject in the start, because throughout the 8 months, I have covered almost everything in the course portal. I have never read anything other than the portal. I just went through each and everything in the portal. So I took first 5 months for the core subject, but it won't take that much time for most of the people because I have a little one. It took me a lot of time. And for the last few months, I took complete 2 months break. Um, I have attended all the mock exam, which is the must, and please do attend because each and everything will be discussed in there. And what are the inputs you get? It will be very useful in your exams. How to read the questions, also how to answer difficult questions by elimination method, and how will you choose each and every answer? Why it is not a right fit for this question also. For revision wise, I have followed um, the mock previous ADC exam questions. I have read through them at least twice, and also the topics and revision folder. I have also read through them at least twice, which was very useful. Though it was like very elaborate, try to pick very few questions which are very important, like repeated questions. If you have any doubt in any of those, which is from TG or any of the other books, just try to go through them and then read them. If you uh, have doubt in any of those questions, don't just get delayed to look at them and read them. Just right away go through TG and then make sure you don't do something, you have something wrong in your mind. Just clear those doubts straight away. That will be the key. For the last 10 days, I made sure I'm getting bit prepared, not too much stressing on uh, like already existing content. So I revised through those topics, and I myself had some shots. So I could revise few of the numbers, like a few of the numbers which can slip out of your mind, like age of the tooth eruption, times something like that, which is very easy to slip off the mind. So make sure some of those very important things so that you don't make mistake in the exam. The key is just go attend all the mocks, go through the previous mock exams and also the revision folder. So everything will be covered in there.
All
Thank
right.
you,
Thank you
Kari.
so much, Doctor, for your time. And
Yeah, sure.
I wish you all the best in the practical exam preparation. Make sure that you don't delay your practical exam preparation because that's very important. Although content-wise, the practical exam is not that much compared to the written exam, but it requires perfection, which makes it even more tougher. All right. But the Academy is happy to guide you with that as well. If you have any questions in regards to the practical exam, we have a complete course that we run. So make sure that you can contact the Academy, start arranging the home setup because that's very important. That's where your all preparation will be based on. All right. Thank you
Yeah,
for your
sure, doctor.
time and
Thank
all
you
the
so
best.
much.
And hope you enjoy the success. All
Yeah,
right. Who
thank
else
you,
do we
doctor.
have here?
Can I go next?
Yeah, I would say I had quite some time before, enough time to prepare because I started preparing in September 2024. I joined the academy last year, 2024, around June. But then I saw that September was too close for me to sit the exam, so I decided to let that pass and attempt the March exam. So I had quite some time. Some of the strategies that I used, I made notes on the core subjects on areas that I felt were important or areas that I felt I would need to refer often. And for me, I'm the guy who likes to make notes. I think I understand better when I read and write. So depending on one, you can choose whether to write notes or just to read through. I made sure that I went through the infection control and the therapeutic guidelines around, I can say I did 3 times from start to end. But more importantly, I made notes on therapeutic guidelines, which were very easy for me to revise when it got close to the exam time. The other thing I would advise the candidate is try at least each and every day to spare some time to read. For me, I used to do maybe 2 hours a day, and on my off days, I could do 8 a.m. to around 2 p.m. And depending on the energy, because it's not every day that you are energetic and you have the psyche to study. So when the energy is there, I would read as much as I could to compensate for the days when the energy is low. And honestly, there are times that you feel drained and you don't feel like reading. You have the off day or you have the time, but the energy to read is not there. So maybe that's something you can pick when you have the energy. Just read as much and retain as much as you can. Then some other technique or strategy that I learned from Dr. Raza is a strategy that will come in very handy during your exams. Whenever you are confused with the answers, because ADC has a tendency to give very tricky answers and answers that are all of them might seem wrong or all of them might seem right. So the elimination method, it came in very handy during the examination, and it's something that you can start practicing as early as from the mocks, from the grand mocks, from the live mocks. Then also be very keen when reading the question. I used to make some silly mistakes when doing the mocks, and then when the revision is being done, you realize it was just a matter of you reading the question wrong. It's not that you didn't know the answer, but simply because you read the question wrong, or you didn't pick out the key words or what the question intended to ask, you simply picked the wrong answer, because most of the questions are repeated, but the exam might be intending to test on certain thing, but the answers might be the same, but depending on what the question wants, you might pick a wrong answer if you're not keen. So that's my take on the preparation. Also, there are some sacrifices, as the previous two candidates have said. There are some sacrifices that you have to make. at some point. It's not a must, but for me, I had to make a sacrifice. I used to have two jobs, one a full-time job and one a locum job, which I was doing part-time. So I had to quit my locum job for 2 months to the exam because I felt like I needed to have more time to prepare, and sure, I did give good results. So you can weigh your options when as you go by, but it's a doable course. It's a doable thing. I actually managed to do it in my first attempt. So I wish each and every candidate all the best and trust in yourself. You can do it. Thank you.
All right. Thank you, Dr. Vincent. And I hope you all the best. Enjoy the success and
Thank you.
get serious about the practical as well. Start to gather information, start to gather materials. I believe you're already in Australia, so it will not be very hard for you. There are many suppliers.
No, I'm actually not in Australia.
Oh, you're not in Australia. All right, but
Yes,
that won't be a bigger issue since you have major
okay.
companies delivering it to any countries across the world. We have one in Sydney, one dental, and the other one is in Mumbai, India, Nevada. So I don't think so you'll have a issue in regards to that. But get the material, get the preparation started, know what you need to prepare. The first thing that everyone who has cleared the exam, who is in the session and who is not, is the reading the ADC practical examination handbook. All right. That's the most important thing. First, know what the exam is, what the task is, how the exam is structured, what the task expects from you. All right. Don't follow all these social media and Facebook crap. All right. Don't get yourself disturbed. You know yourself best and you're the best judge of yourself. Make sure that you read the practical exam handbook and then see how you can incline towards your preparation. All right. Thank you so much and all the best. All right. Who do we have next here?
Doctor, I can go.
Okay. All right, you can start, no problem. Dr. Andusi, you can start, yeah.
My name is
Dr.
Dr.
Tasneem, just give me a
Anisha.
second. After that, you can start. Sorry for the interpretation.
Oh, that's okay.
Okay, my name is Dr. Anisha Muzondo. I'm from Zimbabwe. And this was my second attempt. So the first attempt, I studied 1 month before the September exam, and it went terribly. I was by myself. I didn't have a mentor, and I only got one cluster. So from then I knew I had to do something. So that's when I decided to join Dr. Raza's academy. So I just wanted to encourage people, especially if they don't feel they have time, because I feel I'm a little different from the other candidates. I was actually working until the only day that I didn't work was the Monday before the exam. I was working throughout, and I didn't have a study partner. So I was literally just by myself. So what really helped me, and I also struggle with procrastination. So believe it or not, I only started studying January the 19th because I was struggling with that. I decided to do smart studying. I realized I didn't have enough time to read everything. So what I did is I would structure my day into days of 4 and days of 3. So the subjects that I saw that had a lot of content, I would decide that Monday, Tuesday, Wednesday, Thursday, I would only read, like, let's say I would choose maybe implantology, resto, endo, and I would read those in that day. So I would just make sure only those days I would read everything that I can in those 4 days. And then the other 4 days I would read other things. Then I made sure that at least 1 hour a day, I would read TG. So I was reading it very slowly. I only managed to read it twice. So it's not like I've managed to read it, but I would read it very slowly so that I would make sure everything is going in. And the other thing that I did, I made sure, because I think a different time zone to a lot of people. It's 10 a.m. here. I would never actually make the live revision sessions. So I made sure when I did the exam, I would finish the whole revision session, because I realized that if you write an exam and then you answer it, sometimes you get the answer correct and you think you understand why it's correct, or maybe you've just made like a good guess. So by actually watching the revision sessions, I would actually understand why the answer was correct and why the other answers was correct. And the other thing that really helped, was the revision, I think the revision session, group, like in the portal, like look at that, especially if you've noticed that Dr. Raza has highlighted the information there. Just make sure you look at that and try your best to make sure you do everything in each cluster per week. So make sure that by the end of the week, you've at least done one thing of each cluster. Because I think a lot of people had trouble in the professionalism section because they would just maybe focus on the other three, and that one, because it has less information, you would think that you would automatically clear. So yes, so for people who don't feel like they have enough time, you can make it. Just make sure that it doesn't matter if you don't cover everything, things that you know that you don't know, make sure that you try and read a little bit of each. And I feel like the exam sessions, like the mock exams, will supplement any information that you don't have. And I also made sure that I would read the answer script, because Dr. Raza would actually put notes in the answer script. So that would also help me understand why certain answers were incorrect by reading the answer script. And I would make sure I watch all of the recording, even though it's like 2.5 hours. Like I would make sure that I would read all of it. So yeah, I think that's my input.
All right. Thank you so much, Doctor. What have you planned for the practical?
I'm joining the session as soon as possible.
Okay, you're in Zimbabwe, right?
Yes. I will try and do the home setup. So yeah, I'm gonna make it work.
I think we had this candidate. I have a few candidates in Zimbabwe. I think two of them cleared in March, and I have few from the last September session. Maybe you can contact them and see how they can help you with the home setup. That's the most important thing. Courses, yes, you can take online, that's fine. But arranging the home setup and the material and the mannequin and the taphodont, which the ADC specifically asks, because the teeth that you need to use, you have to purchase it from One Dental or Nevada. So just check who you can contact, all right? You might find someone on Facebook. If you can search in our group as well. But if you can't find anyone, you can just let me know. I'll see if they are still living in Zimbabwe or they have shifted to Australia. Because if they're still in Zimbabwe, maybe they can help you. All right? Thank you.
Okay,
All
thank
the
you.
best and enjoy the success.
I gave my September attempt and I couldn't clear it. And I joined Dr. Raza's crash course like around in December. And the only thing I joined it because of how structured the mocks are. And you don't need to go and solve other questions or anything any related to any topic. The mocks are well designed and it is like consistent. He keeps you consistent. Like today you are giving the mock for 2 hours, make sure you give the mock in that 2 hours, because if you miss it then you will never get a time to solve that mock again. So consistent is the key. Like every day decide to study anything, like anything related to the exam. Don't just say that, okay, there will be a time where you will feel that, oh, today is not the day, I'm very tired. But no, at least study TG. TG is a must. And yes, infection control. Don't lose on to basic topics that you think, oh, I know this, but at least give it a read once, because in the exam they do check you on to basic topics also, and you might tend to make mistakes, and even one question mistake you will feel like, oh, why did I do mistake, and you might lose your grade over that. That's what I realized, because I just missed one cluster in September exam, and it feels heavy, but still you need to get back and you need to study. And just like what I did was, I trained my brain for at least 2 hours before the exam to sit and just do mocks. And then I took 1 hour break. That how the exam goes like. And Dr. Raza's mocks, I think so, it has like 100 questions. So it's very good for you. And this way, it will be very easy for your brain to catch up questions and you'll be able to solve. And the best thing I like about this is that whenever you ask him a question, he never says that, oh, this is the answer. This only has to be the answer. He'll always tell you, look at the scenario. Scenario can be different. So you need to study that way. That's it.
Yes, sorry, continue, please. Yeah.
And just clear your concepts on every topic, because that's the must. Any question, if they throw you, it is not going to be out of the syllabus. So if your concept is clear, you will not fear any question coming out to you. And just like solve mocks as much as you can, because that's the end of the exam. You're just going to do that and study what is relevant for the exam. Do not run out, like whatever he provides you in the portal, that's it. Do not, like, if you have time, if you enjoy reading, go ahead, read something, that's fine. But your aim is to clear this exam. So what is relevant for the exam, you study that, not like other topic. Don't waste your time, because it is very important. If you study right from the start, I only just gave 3 hours, because for one per day, I just used to give 3 hours. 1 hour should be my mock, and 2 hours, whatever mistakes I used to do in the mock. And also keep a separate book. That's what I did. I kept a separate book. I decided, like, I'll start the mock, whatever mock was released, I used to do that mock. And wherever questions I felt that, okay, I get confused between two options that will always be there in the exam, I used to note it down, that why, like B and C, I'm confused with. And whenever the next day Dr. Raza used to discuss it, I used to clear my doubt then and there only, that okay, why not B and why not C. And then when you're revising it, the answers what you already know, you don't need to waste time on that, but the answers which you are getting confused in, you need to get. So that will help you out, that will save your time, and that, you'll at least you'll do smart study that way. So whatever relevant for the portal, he has already given it to you. Don't question that this is enough or not. That's the reason I cleared this exam. So it is a doable thing. Just get back to it, and I wish you all the best for your September attempt to everyone. Thank
Thank
you.
you so much for your input, Dr. Tasneem. What have you planned next?
Sir, I've already contacted you for the part two.
You're in
So
Australia, I believe, right?
yeah, I am in Australia.
All right, so it will be easy for you to gather the instruments and materials. Maybe you can find someone who's selling the home setup, and
Yes.
maybe you can just get it from them. But the investment that you put in home setup is not going to be something that will go to waste, because once, hopefully, inshallah, you clear the practical exam, you'll be selling your home setup as well. So you can
Yes.
find multiple pathways to get the home setup. Either you can check on Facebook, but more importantly, you can check in our Facebook group itself, because we have a lot of candidates who have cleared the practical exam. Most of them cleared the week before the written exam results got declared. So maybe they are willing to sell. If they are in the city where you live, that will be easier. But even if they are in Australia, they can post you. All right.
Yeah.
Thank
Yes.
you, and
Yes.
all the best
Thank you.
for
Thank you so
your
much, sir.
practical exam. Make sure that you focus, work hard in the same way that you work for the written exam, and then the results will be achieved. All right. Thank you
Yes.
so much.
Thank you. Thank you so much, sir.
Okay, that's fine. So I'll just answer the questions. Candidates have asked here, how you manage your time during your exam. Well, of course, it depends on how well you are prepared, right? So during the exam, time management will only work out if you have practiced a lot of mock exams beforehand, right? We have roughly around 25 to 10, 27 mock exams. Some of them are in the portal, some of them we have live, and then we have discussions for that. So if you follow the mock exam seriously, the discussion seriously, and you allocate yourself a time for the mock exam, that you will do this mock exam in this particular time, then it will be easy for you to comprehend on the day of the exam. Now, some candidates have asked me that the mock exams, why don't you have a separate website for that? The reason why I don't have a separate website for that is because we have candidates all across the world. So for me, it's not feasible to just allocate a time to the mock exam, because the other candidates will not be able to take it. So that's why I want you to time yourself when you're doing the mock exam, because if I just give a particular time frame, the other candidates who are not in the same time zone as me will miss on it, and that's not something that will be fair with them. So I need to be fair with everyone who's enrolled in our course, no matter which part of the world they belong to. So that is the reason why I upload the mock exam and let the mock exam be there as long as possible. One, so that everyone gets the opportunity to attend the mock exam. Secondly, you can revise the mock exam as many times as you want, because it will be available in the portal until you sit for your exam. All right. But yes, management of the time is very important, and that comes with practice. Is it hard to land a job after clearing ADC? Not really. There are many dentist sponsors willing to sponsor you for a dentist role. So I don't think so that would be a problem. You might have to work for the first few years if you're not in Australia, in a regional area. But working in a regional area is not something that should be, looked down into, because the pay is really well, and regional area in Australia are very well developed with all the resources. So the only thing that you need to focus on is clearing the ADC exam. Once that is done, the further path is very easy. There are many jobs. If you can't find jobs, you can contact me. I know a lot of sponsors who are willing to sponsor candidates who are especially overseas. Was it your first or second attempt? Like the candidates have mentioned, some of them cleared in the first, some of them cleared in the second. How many times would we be recommended to go through core subjects material? The core subjects material is to gain information that you learned through your dentistry career, right? Because all of you are dentists. So the core subjects basically help you revise those things. So my suggestion would be that you don't need to read it more than once or twice. And then once you are done with that, once you're doing the mock exams, the past questions, use the core subject as a reference to go back to if you feel that you're struggling with any subject or any topic. Is it important to read books completely like TG Odell? Definitely, TG is a must. You can't pass this exam without TG. TG should be on your fingertips. At least 3 to 4 times you need to know TG. And again, to make TG easier, we have 2 mock exams for TG. We have a revision for TG. We have MCQs revision for TG. So to keep it easier, and then in the past questions and mock exams, we cover a lot of aspect of TG. So even if you read TG once or twice, and then you use the question as a base and TG as a reference book to go back to TG when you face a question, that is also called smart studying. Did you read TG a couple of times? Of course, they must have. And someone has already mentioned, like I've already said, it is a very, very important book. How many hours should we dedicate for the preparation? Now, of course, the preparation is not the same for everyone. Every candidate is different. Some have family commitments, some have work commitments, some have marriage commitments, some have children. So it's not the same for everyone. But my opinion would be to dedicate as much time as you have towards the preparation, right? Because this is the goal that you have set for yourself. So you need to work towards the goal. Can you share how you structure your study schedule? Did you follow a set plan each day or week? I think the candidate has already mentioned this, how they have structured the study. But again, it will not be the same for everyone. Everyone is different. You can see what works for you. And again, you're not a child. You know how to, you're already a dentist. You know how to see where your weak areas are so that you can focus more on that. But again, make sure that this portal has been created for you. It's basically spoon feeding the candidates. So make sure that you don't miss anything from the course portal. If you want to read anything extra, that's your choice. We have a ADC reference reading list in the core subjects folder where all the ADC reference books have been mentioned. You can use that as a reference when you come across a question that you feel you want more information about. You might already get more information in the answer key and the discussion that we have. But of course, if it is not there, you can always use the ADC reference list and the books that we have in that particular folder, because in the orientation video, I have mentioned that you don't need to read this content of this folder, but you can use it as a reference whenever you feel that you need more information about a particular topic. According to your experience, would you say that the questions in mock exams are quite similar to the ADC written examination? Like the candidates have already answered, yes, the questions are very similar, but not exact. And of course, the questions depends on the center. Candidates who are giving the exam overseas might have questions options changed a bit, but the theme of the question remains the same. Did you find any completely new question in the exam? How did you deal with them? Now, I believe, yes, there might be certain questions that will be new in the exam, but like some of the candidates who just gave their input, they mentioned that the theme of the question will be the same. So if you know what you are reading and you know the base concepts and the core knowledge about it, you won't find any question tough to answer. Did you finish all the reading materials from the exam portal? It's already been answered. For September exam, which month should we finish course subjects and when do mock exam starts? The mock exam will start 2 to 3 months before the exam date. And because you will be already part of the Academy's WhatsApp group, so all the details, dates, session timings, links, everything will be posted there. Is it the same process to enroll into the course again? Now, if you have been already the Academy's candidate and you have not passed the exam, no, you don't have to pay the entire amount again. It will be just a renewal fee. When we should start doing SBQs? Now, the SBQs that you have in the portal are all ADC past exam questions, which have come up in the exam in the last 10 years, completely solved with references. I won't recommend starting with SBQs because first you need to know the core knowledge, because if you start with the SBQs and mock exam, you will start feeling a bit depressed that you're not able to answer any question. So my opinion would be not to start with the mock exams and the ADC past questions. Although this collection is huge, you should start first building base knowledge and core knowledge. But Again, everyone is different. If you feel that you already have the base knowledge and the core knowledge and you would like to start with the mock exam and the past questions, you can do that. But if you feel that you are struggling with a particular question, you can always use the core subjects and the reference reading to gain more knowledge about that topic or question that you struggled with. Is the revision folder as important as core subject folder, and do we need to read it only after 2 mock exam, or we can just after core subject folder? The revision folder is very important, all right? If you ask me about the emphasis, I would say that it is very, very, very important, because the revision folder has a folder which is called as trauma. ADC loves trauma for some reason, right? And then you have Academy's personal notes that I have made. Then you have certain articles and guidelines, ADJ and AD articles. So the revision folder is very, very important. You do it before the core subjects or after the core subject does not matter. The reason why I say it does not matter is because everyone enrolls at a different time. We don't have a fixed date of starting the course. The reason behind that is because candidates all across the world, they enroll at a different time, at different months. So we can't just say that, okay, we have started with this and you have missed this. So we need to accommodate everyone. So how you need to follow the course portal, that depends on you. We have given our preferred method in the orientation video. That's what we believe is going to help you. But again, it depends, right? Because someone will enroll in the academy probably in the month of May. So when he enrolls in the month of May, I'm not going to ask him to go through the core subjects, right? Because he just has 2 to 3 months until the exam. So then his preparation strategy would be different compared to someone who is already enrolled or someone who is enrolled now. So you have to see where you stand. But the most important thing is to dedicating time towards the preparation. If you are not serious about the exam, nothing is going to change. This is not an easy exam, but it is doable. A lot of candidates have done it, and a lot of candidates will do it. Could you please provide guidance on renewing the course? Now, for renewing the course, please just message the Academy on their official email, which is adc.academy.melbourne, or you can leave a WhatsApp message and you will get a reply within probably 24 hours. All right. So yeah, that were the questions that were asked. Now, candidates, you see, who have not cleared the written exam, you need to make sure, especially those candidates who missed by one cluster, that does not mean that you have not prepared for the exam. You have prepared for the exam. Missing by one cluster basically means that you messed up with 1 or 2 or maybe a couple of questions. So don't take the results to your heart. In these professional exams, sometimes things don't go according to the plan. Sometimes things don't go according to the wish that you would like them to go. So don't take these things to the heart. Yes, it's normal to be sad. It's normal to be a bit depressed for a week or so, but that's fine. Once that is done, get along, get it started again. You have heard from some candidates feedback that they have cleared in the second attempt. So it's not that it is not possible to clear the exam. It is possible. Yes, ADC has certain restrictions. ADC cannot pass everyone. ADC sets the percentage of pass quite high, but these things are out of your control, right? You can't do anything about them. What you can do is to keep yourself in the journey, keep yourself involved, dedicate time towards the preparation, and dedicate yourself towards this commitment that you have made with ADC, that I will clear the ADC. You have set this goal for yourself. So be serious about it. And by serious, why I'm saying this, now I remember having the live sessions. We had 20, 30 live session discussion, mock exam session discussion, question answer session discussion. I used to see 50% of the candidates are attending them and the remaining 50% are not attending. So if you are not serious about it, if you are not inclined towards your preparation, then it will not change. Please remember that. Nothing is going to change if you're not serious about it. No matter which course you take, no matter how expensive the course is, or no matter how cheap the course is, or no matter even if you don't take any course, if you're not serious about the ADC exam preparation, and I've seen those candidates who were never serious, they did not pass the exam. So it's very factual, a very true facts. There is nothing exaggeration in this. So I don't want to, divert the candidate attention with fake this numbers or fake posts. This is a very straightforward process. You're logical. You shouldn't be treated as a child. You're a professional dentist, and you need to know the seriousness of this exam. So if you're serious about the preparation, if you're serious about your journey and the goal that you have set yourself, you will clear the ADC exam. Now, at times, it might not be possible for certain candidates because, of course, candidates who are overseas, they are working full time, they need to earn an income for their family, their children. So at times, it might not be possible. So in my suggestion, if you feel that you will not be able to prepare yourself for the upcoming exam, try to delay the exam. You can set the exam in March. 2 to 3 months of difference won't cause much of harm, right? But it's better to be prepared and then attempt the exam rather than just rushing towards the exam. And then when you get the results, getting sad about it. Okay, we have any difference in question paper overseas in Australia? Not major differences, but yes, there might be certain differences. We have actually noticed this. I think in the March, I have not noticed that, but in the September exam, we noticed that candidates who sat the exam overseas had some options and question statements changed. I think ADC does this because the candidates who are in New Zealand and Australia, they attempt the exam first compared to the rest of the world. So in order to have a fair process, they do change certain question statements and option, but it does not mean that it will be hugely different. All right. Dr. Raza, can we take the Part 1 exam in basically Philippines, right? I'm not sure if there is a center in Philippines. I think I have a few Philippine candidates with me. If you have Pearson VUE, then definitely you will be able to do that. But I think you can. Actually, I don't know. I do have a lot of Philippines candidates with me. Most of them are with me in the practical course since they cleared last time. But I'm not sure whether when they were giving the written exam, they were in Philippines or were they in Australia or any other country. I know a few who were in Australia, but I'm not really sure if there. I think there is in Makati. So yes, you got your answer, and I think that would be fine. All right. But yes, I believe it would be because there are a lot of Philippines dentists who are attempting the ADC exam, and that would be fine. All right. Anyone would like to ask me any other question? Anyone would like to ask me by asking me live rather than posting in the chat? All right. Thank you. Thank you so much. This recording will be posted in the Academy's Facebook group, all right, probably in the portal as well, just to give you an idea for those candidates so that they can listen to it later on. If you have any further questions, any doubts, any problems, you can message me. You can message those candidates who have cleared the exam if they're willing to help you. That would be good as well. Keep yourself involved in the journey. Keep yourself focused and determined to pass the exam, all right? If you have not passed the exam, that does not mean that everything has ended. There are many opportunities that life gives you. You can always take the exam, be more prepared, and work towards it, all right? Thank you so much.